program when we started. When we started AMR program, we got the opportunity to invite our health minister. He was so impressed by that by this meeting, and he told, "I don't know this much of importance is there for AMR. First time I'm listening this AMR, so we are very happy, sir, to convey this great program to all the public in Andhra Pradesh. I'm sure, of course, this what you call the hand hygiene is going to start on 20th from the hands of the national chairman Dr. Sayani sir. And really, I'm very happy. This program has been encouraged by our Honorable National President Dr. Banishali sir. I'm very, very happy. I convey my best wishes to this program. I think this whole time from 18th to 24th should be very successful and very useful to the public of India as well as Andhra Pradesh. Thank you very much, sir.
Thank you, Dr. Bose Garu. Kindly accept a bouquet.
Thank you, sir.
Now we have the turn of welcoming our national leaders. We have our national president and Dr.P.S. national president, and also Dr. Chairman of AMR committee of the headquarters. So now it's my pleasure and privilege to welcome our national president, Dr. Dilip Bhansali, to formally inaugurate and give his message. Over to you, sir, Dr. Dilip Bhansali, national president.
Thank you, Dr. Sharma.
Okay, accept the bouquet also. Okay, sir. Thank you. Carry on.
Dr. Sharma. Namaskar to all of you. President of AP IMA, Dr. Nand Kishore, Dr. Bose, the Secretary. Warm welcome to our past National President, Dr. Samram Garu, our Chairman of AMR, Dr. Narendra Sayani, Dr. V.S. Prasad from the CGP, Dr. Panlidhar, and other leaders from the AP who have joined this debate. Well, a very important subject which has been rightly and aptly taken today. As all of you are aware, we are going to celebrate this from 20th, from 18th to 25th, about this AMR Awareness Week. Now, this is a very important subject which at the national level, Dr. Narendra Sayani has taken for last almost 1 year. After this, so many programs have been conducted to bring the awareness, the havoc of AMR. And as I said in the last meeting, Dr. Sharma remembers that there was a flash that 83 to 85% of prevalence of resistance of antimicrobial in our country. That figure is really frightening. It's a really frightening matter. This paper had come in Lancet, and our own son of the soil, Dr. Nageshwar Reddy from Asian Institute of Engineering, was one of the investigators in this landmark study, which showed that 85% of antibiotics are resistant to antibiotics. Now, there are so many reasons why we have got this. A few of the indiscriminate use of antibiotics. Second is, as we were talking before this program had started, online getting antibiotics. That should be total stopped. Online antibiotics. Third thing was quackery. Quacks have played a very major role in the, they described third-degree antibiotics the day one without knowing the indication. And you have seen our practice, although homeopaths, Ayurvedic doctors, 95% of them, they prescribe our medicines. So now this matter has to be brought up at the highest level. In fact, we are going to write to the Prime Minister, in fact, to the Health Minister. This has to be absolutely taken in a very big way. I'm sure Dr. Narendra Sayani has programs for this. In fact, we are going to do a program in Delhi regarding this awareness program of AMR. Dr. Samram, who is a well-known figure throughout India, past president of AIMA, is going to throw much more light on that. Dr. Narendra Sayani also is going to give us the figures on this. So collectively, let us propagate this antimicrobial resistance program throughout the country. As Dr. Sain is going to say what the programs he's lined up for this. And collectively, let us see what best we can do for our society. Thank you.
Thank you, Dr. Dilip Bansali garu, for your wonderful opening remarks and sparing your valuable time and be with us. Now, it's my pleasure to welcome another national leader, Dr. Prasad, Dean of CGP, to say a few words. Over to you, Dr. Prasad.
Thank you, Dr. Sharma garu. And respected National President Dr. Dilip Bansali garu, and Dr. Narendra Saini garu, and State President Dr. Nanda, State Secretary Dr. Bose, other dignitaries. This is a very good program, AMR, under dynamic leadership of our National President Dr. Dilip Bansali, where IMA headquarters doing a lot of programs, very good programs, and good for community and our medical fraternity also. And I congratulate Dr. Dilip Bansali garu organizing such a dynamic leader, organizing a lot of programs useful for us. I'm very happy to be in his team. Thank you, Bansali garu. And I am happy to announce that in coming GP Con, which is going to be organized on December 6th and 7th, we have organized one slot for AMR, and Narendra Saini, Dr. Narendra Saini is a speaker. So we are also taking part of that, and I thank Dr. Sharma for giving me an opportunity to be with this program. Thank you, sir. Long live IMA.
Thank you, Dr. Prasad. Now it's my turn to invite our another important national leader, Dr. Narendra Sayani. So, who is a very well popular microbiologist at Delhi and has served the Delhi Medical Association as president and has different posts in IMA and he was also Secretary General in 2012 to 14 and is presently the chairman of Dr. IMA headquarter AMR Standing Committee. So, over to you, Dr. Sayani, sir, for your message and give your blessings. Please accept a bouquet. Over to you, Dr. Narendra.
I accepted the bouquet, sir, with a humbleness. Respected National President Dr. Bhanushali, sir, our past National President Dr. Samaram, sir, the State President, and all the dignitaries, and Dr. Samar, sir. I think I'm really privileged to be speaking here. First of all, I thank Dr. Bhanushali giving me the freedom to do programs in different parts of the country and to highlight the problem of AMR in the country as well as in the CMO country, also Commonwealth countries. This is a great issue. This is a big problem in the entire world. 10 million people are going to die in 2050 if the problem continues like this. What is the problem? The problem is they're all stakeholders in it. Nobody is recognizing because it is not a disease. AMR is not a disease. Nobody is taking it. TB is a disease. So everybody, when the TB symptoms rises, everybody is awake that what is happening. The government is working on that. If a dengue is rising every day, you will find in the newspaper every day a headline is there, a dengue outbreak is there. If there is a malaria, there is a news. But unfortunately, for a problem like AMR, it is not a news. It is not a disease. No. It is a combination of it involves so many other things. That's why it is becoming a big issue. 10 million people means 1 crore people will die every year in 2050. You can just imagine that during the COVID pandemic, we lost 70 lakh people. And what a havoc it has created. Just think of 1 lakh people will be dying. So we have to do everything now. And who is the stakeholders? Stakeholders, if you start from here, is the patient is a stakeholder. It is a civil society which is a stakeholder. It is a pharmacist who is a stakeholder. It is the unqualified doctor who is the stakeholders. It is the medical profession, and top of it as medical doctors, because we are treating patient wherever the problem will be, but it will lie at the top. It will always come on the shoulder of a doctor only. If the patient will die because of overuse of antimicrobials, underuse of antimicrobials, or if the antimicrobials is not working, we are going to suffer. The cases will be on us only. So it is very important to start such programs, creating awareness among the public that antimicrobial resistance is an issue. It is like a TB. It is like a malaria. You have to take into account. Never take antibiotics without the prescription. That message has to be inculcated in the mind of people. Otherwise, ultimately, we will be the sufferer as a person who is curing the disease, because we'll not be able to cure. We will be getting unnecessary bad names. So it is in our interest that we should. And on the supply demand, previously there was not an issue. 1928, penicillin was discovered. And what a great relief it was to the world that we were able to curtail the infectious diseases. After that, it is a natural phenomena that that the bacteria will get resistance. But at the same time, what was happening, it was not an issue because new antimicrobials were coming. But from 1982 onwards, we have no antibiotics. The daptomycin, which was discovered in 1988 or 1985, it came into the market in 2005. So that after that, we do not have any other antimicrobials. And moreover, whatever diseases which are encountering as of a patient, you find most of them are URI and other things. Unfortunately, we also are prescribing antibiotics. When we say to a patient it is a viral disease, but at the same time, we know that the viral disease is not required, but we are giving antimicrobials. That has to be, practice has to be curtailed down somewhere. We have to sensitize our own doctors. We have to sensitize the public. So a huge responsibility on our shoulder. But for that, I think Andhra has got a great leader, Dr. Sharma. I am seeing his WhatsApp groups, his messages. He is doing such a marvelous job. Thank you so much, Dr. Sharma. I always enjoyed working with you. Thank you so much for giving me the opportunity also to speak it here.
Thank you, Dr. Sayani, for your motivating speech. And really, you rightly pointed out the relevant points which are very necessary in preventing the AMR. Now, before
Sir, one more thing, sir. One request.
please
18 to 24 is our AMR awareness week. I request all our branches, all our hospitals to please do activities. But once you have done the activities of 18 to 24, by 24th of night or 24th morning, please send this all to IMA headquarters. Already we have shared the link with you. Please send this to us so that we can go through that. First 3 hospitals or the branches or the state branches will be given the trophies. That has been agreed by our national president. So please do it. And we have made under the supervision, under the leadership of our President Dr. Bhanushali sir, 20th November, please note it down, 20th November, 12 noon is a National Hand Hygiene Moment declared by Indian Medical Association. So make it a successful. Wherever you are, we have written hand hygiene moment. So if you can do hand washing, or if you can do hand rub, not only you, your patient, your NGOs, if you have any NGOs, anybody in the society, please percolate this message, a first step towards curbing antimicrobial resistance. So please, with this message, take a selfie and post and and post it in your social media. That is our humble request. Let this 20th November be remembered by each and everybody, that in November 20th at 12 noon, 2025, Indian Medical Association has made a history. Thank you so much.
Thank you, Dr. Nayani, for the wonderful information. And before I proceed further, I wish to inform our national leaders, that is National President and also Dr. Sayani and Dr. Samrangaru, our action plan of our AP state under the guidance of our President, Dr. Nandakishore. So the launching is being done today, sir, through this webinar by the National President. We thank him very much. And today morning also there is a AMR awareness talk on a local TV here, wherein I have addressed in local language in Telugu regarding the importance of AMR. And another important point is Go Blue. We are wearing the blue dress. Actually, I am also wearing a blue T-shirt. And morning also I wear a blue T-shirt and posted in the Facebook and all. So Go Blue is another important thing. Wear a blue dress, and then not only on any day, or though not on all days, on any day, and take a selfie and upload it in the social media. So that is a very important item to be taken up. And as I already pointed out, on 20th of November, 12 noon, hand hygiene activity, wherever you are, whatever you are, you do an activity and again take a selfie and then post it in the Facebook and also share it to IMA. And as already told by our the president also, during our coming up AP State Conference, there is a session on AMR. That's what was told by Dr. Balaraj Garu, the incoming president. Another important thing I want to share, especially to the notice of the state president and Dr. Sayani, we have, and with the blessings of the NTR Health University Vice Chancellor, we have conducted a essay contest to all the medical colleges, the postgraduate students, because AMR is a subject, not maybe the undergraduates may not be able to follow, but postgraduates we definitely should be able to follow and do. So we have conducted an essay level contest at the state level to all the medical colleges, both state and government, and 10 medical colleges participated. And then the prizes at the college level will be given. And 2 entries are, we requested them to send 2 entries to me. And then out of all the receipts of the entries at the college level, at the state level, we will select top 3, and they will be given prizes, certificates, and medals at the ensuing conference at Rajampeta on 22nd evening during the inaugural. And also at the college level also will give them prizes and certificate of participation to all the participants who are participated. So this is our action plan from 18th to 24th, sir, definitely. And also, I mean, any other local activity as per their convenience, we request all the secretaries, and also we'll issue a circular from the state office to all the branches to do the needful. So this is our action plan. And now we have our incoming president, Dr. Balaraj Garu, the president of IMA AP State, incoming president, who is taking over at Rajampeta on 22nd evening. Over to you, Dr. Balaraj, for your message. Dr. Balaraj Garu. Hello. And please unmute yourself. Hello. Anyway, we have another past president, Dr. Ravi Krishna Garu. 2 words from you. Dr. Ravi Krishna.
Sir, good evening, sir. Good evening, sir.
Over to you.
Sir, respected National President Dr. Banshavali, sir, and our IMA AP State President Dr. Nandakishore, sir, and organizer of the program Dr. P.S. Sharma, sir, and President-elect Dr. S. Balaraju. We are very happy that IMA AP State is hosting this program, and especially we are thankful to National President for participating in this program as a guest to inaugurate the program and launch the AMR awareness program. And I hope National past AMA President Dr. Samram sir keynote address will definitely enlighten us on this subject in the coming hour. Thank you, sir. Thank you for giving me the opportunity.
Thank you, Dr. Krishna Garu. I may just inform our honorable members that this technical help is from Dr. Ravi from their branch side. Now over to Dr. Balaraju, incoming president. A few words from you. Unmute yourself and say a few words. Dr. Balaraju.
The
yes.
elders and
okay.
Sir, audible, sir?
Yes, carry on.
Sir, good evening to all stalwarts of the IMA and National IMA, Sir, it's a good initiative. Plus, in November 22nd and 23rd is conducting state conference at Rajampeta, Annamaya district. So we will continue this AMR. Sir, hello.
Continue,
Is
sir.
audible,
I'm
sir?
hearing you. Continue.
Audible,
Okay.
audible.
Okay. Basically, this antimicrobial resistance is very subject, and also we are introducing one oration and Perisastri Memorial Oration on antimicrobial resistance. Oration also is there in the 22nd conference in elaboration. So thank you for giving me this opportunity. Thank you, one and all. Thank you, sir.
Thank you, Dr. Balraj, incoming president, for your,
Balraju,
and
Sir.
all of us for the
please
conference.
welcome National President from your side also for our conference.
Sir,
Sir is here in
Dilip
this meeting.
Bansaligar, sir. Sir, we are pleased to, we are inviting to the conference 22nd on Rajampeta, Annamaya district, sir. Sir, Dilip Bansaligar, sir.
It's okay. Okay, Balraju.
Okay. Carry on.
Thank you, sir.
So thank you, Dr. Balraju. And now, before I request our keynote speaker, Dr. Samram Garu, just I will briefly introduce the subject of AMR, what it is. So, and what is the importance of this awareness week. So, World AMR Awareness Week, that is called WAAW, is a global campaign to increase understanding of AMR and encourage responsible use of antimicrobials. Why it is important? Because it is significant public health threat, as it can lead to untreatable infections, increased illness and death, and higher healthcare costs. And the theme for the year of 2025 given by WHO is Act Now, Protect Our Present, Secure Our Future. Because I don't want to elaborate on that, Dr. Samram will do that. And what the call to action is, the campaign promotes taking action by educating people, advocating for responsible practices, and acting to reduce the development spread of drug-resistant infections. So this is in brief the introduction subject. And now,
shall I recite the AMR pledge, sir, or no need? Hello. AMR
pledge.
Pledge.
After Samram Garu. So now it's my pleasure to welcome Dr. G. Samram. He does not require any introduction at all. He's a very popular doctor, writer of Vijayawada, not only Vijayawada, pan India, as already told by our president. And he's a renowned social worker and the chairman of the Indian Red Cross Society NTR District Branch, and the past president of the IMA state and the past president of IMA headquarters. So with this very few brief introduction of Dr. Samram, I welcome him with a bouquet. And over to you, Dr. Samram, for your message. Over to you, sir.
Thank you, Dr. P.S. Sharma. Respected National President, Dr. Dilip Bansaligar, and my good friend, Dr. Narendra Saini, and IMA AP State President, Dr. Nanda Kishore, and IMA AP State Secretary, Dr. Bose Garu, and also Dr. Pani Garu, and also the President-elect, Dr. Balraj Garu, and the Dean of CGP, Dr. Prasad Garu, and past President IMA President Ravi Krishna Garu, and other national state leaders and IMA leaders, distinguished faculty, senior colleagues, fellow medical professionals, and dear friends. Good evening to all of you. It is a privilege to join you today as we inaugurate the World AMR Awareness Week, WAAW 2025, an important global campaign held every year from 18th to 24th November to increase awareness and understanding of antimicrobial resistance, and to encourage best practices among healthcare workers, policymakers, and the public. AMR is a threat greater than we acknowledge. Antimicrobial resistance is no longer a distant threat. It is a today's crisis. Globally, AMR is responsible for millions of deaths annually. So, as it says, already Naren said that nearly 10 million deaths are happening every year. And because they have surpassing many well-known infectious killers. What is more concerning is that resistance is growing faster than the development of few new antibiotics. As practicing doctors, we witness daily the shrinking therapeutic options, the prolonged hospital stays, increased treatment costs, and the rising mortality associated with the drug-resistant infections. For India, with our large population, high burden of infectious diseases, and widespread antibiotic misuse, AMR is a public health emergency and development of challenge. The World AMR Awareness Week 2025 theme is Act Now, Protect the Present, Secure the Future. This year's theme sends a clear message. Act now, because delaying action will close the window of opportunity. Protect the present, because every day we lose ground as the resistance increases. Secure the future, because the next generation may face a world where simple infections become untreatable. That's why the theme is correct. Act now, protect the present, secure the future. How did we reach here? The factors driving AMR are multifactorial. Overuse and misuse of antibiotics in human health. Easy over-the-counter availability. Empirical therapy without a microbiological confirmation. Incomplete or inappropriate antibiotic courses. Extensive agricultural use in poultry and livestock. Poor infection control, sanitation, and waste management. Lack of awareness among the public and even among some healthcare providers. These issues require a One Health approach involving humans, animals, and the environment. As clinicians, we form the first line of defense against AMR. Our prescribing habits directly shape antibiotic consumption pattern in the community. Today, more than ever, we must commit to one, practicing strict antibiotic stewardship, avoiding unnecessary prescriptions, following standard treatment guidelines, encouraging culture-based therapy, understanding local antibiograms and resistance trends, educating patients about not demanding antibiotics for viral illnesses, promoting vaccination as a preventive tool, ensuring infection prevention and control practices in clinics and hospitals, strengthening documentation, reporting, and participation in AMR surveillance programs. The Indian Medical Association has always been at the forefront in public health advocacy, from immunization to TB elimination, from rational drug use to patient safety. Though webinars, training programs, guidelines dissemination, and community awareness drives, IMA contributes to AMR containment is available. Let World AMR Awareness Week 2025 be catalyst to further expand IMA antibiotic stewardship cells. Continuous medical education on AMR, public awareness through IMA branches across districts, collaboration with laboratories, pharmacies, and local health administration. AMR is not just a medical issue, it is a social responsibility. Doctors alone cannot defeat AMR. We need policymakers to regulate antibiotic availability. We need veterinaries and farmers to reduce farm level misuse. We need industries to encourage proper waste management. We need the public to understand that antibiotics are life-saving tools, not everyday medicine. As we begin AMR Awareness Week 2025, I call upon all my fellow medical professionals to reform on commitment, to prescribe responsibly, to advocate for rational use, to educate patients and communities, to strengthen infection control, to support surveillance, research, and reporting, to be role models for the next generation of physicians. Remember, every prescription is a responsibility. Every rational decision we make today helps secure health of millions tomorrow. In conclusion, AMR is a fight we cannot afford to lose. Let our collective efforts during this World AMR Awareness Week 2025 not be symbolic, but sustained, relentless movement until we see measurable change. Let us act now, protect the present, and together let us secure a safer future for all. Thank you for patience hearing. Long live IMA, long live India.
Thank you, Dr. Samangaru, for your wonderful message. You have very briefly pointed out all the relevant points which are very important to how to control AMR and the role of the IMA and also role of the doctors and the need for the educating our own doctors. And this is an example in the beginning of educating our own doctors, and we carry on the mantle, we carry on the torch of creating awareness from time to time. So thank you very much, Dr. Samrangaru. And now, a debriefing. Some of the screenshots I have taken from the net. So prescribe smart, protect the future. Because we need to protect the future, it's one of the important items in the slogan. So the right drug, the right dose, the right drug, the right dose, the right duration, right route. Every prescription is an opportunity to show resistance. So there is every chance. So we need to be very judicious, very cautious. That is, in one sentence, we need to tell that rational use of antibiotics. I repeat, rational use of antibiotics is the answer. Secondly, so it affects all of us, already told by Dr. Samrangaru. So when antibiotics are overused and misused in animal and food production, it can lead to drug-resistant bacteria. Not only in human beings, it also affects the cattle and also affects the environment also. And preventing antibacterial resistance is another important, that is a challenge. And it is also given by not only our WHO, all the national associations and all over the globe. So in our own humble way, we have prepared the AMR plastic badge, and this will be distributing at the conference at Rajampeta wherein we have the session on AMR. So it gives our IMA logo here and the handle with K. This is the logo given by WHO for this year and our AP state. And finally, already about essay contest, I have already briefed. So 10 medical colleges participated, and another important thing is, with the courtesy of the state organizers at the conference, the top 3 winners will be given complimentary registrations at the conference, and they will be given the medals and the certificates at the conference time. So AMR pledge and vote of thanks by Dr. Fanidhar. Over to you, Dr. Fanidhar. Dr. Fani? Hello?
Yes, sir. Thank you.
Go ahead.
May
The message
I request you?
Pledge JP, vote of thanks. Anni 3 in 1.
Okay. As a closing remark, I should say that the speech, though brief to the point, of Dr. Samaram is very inspiring, and also we are joined by the stalwarts of IMA at national level. It's all very heartening program. I should thank Dr. Sharma garu first, because I was little hesitant to join this for the pressing work I had of the ensuing conference, but I could have missed the very good program, sir. Anyhow, let us pledge for the welfare of the country. IMA antimicrobial resistant pledge. May I request you to recite with me the AMR pledge? I realize that antimicrobial resistance is a public health priority at the global and national level, and for medical professionals. As a dedicated practitioner of modern medicine, I commit to uphold the sanctity of my profession by prescribing antimicrobials judiciously, with integrity and care, and with each prescription. I commit to assess thoroughly and ensuring antimicrobials are used only when truly necessary. I commit to balance the benefits and risks, considering the patient health as well as public safety. I commit to choose antimicrobials wisely, guided by evidence, stewardship principles, and the specific needs of my patients. I commit to defend against antimicrobial resistance, preserving the power of antibiotics for future generations. Together, let our actions contribute to the health and wellness of all,
wellness of all,
free from the shadow of AMR.
Free from the shadow of AMR.
Long live IMA.
long
Long live IMA.
Thank you.
Thank you.
Vote of thanks, Abhishek.
So, on behalf of the AMR committee, IMA AP State, and on behalf of the lead team, IMA AP State, at the outset, I thank the keynote speaker, Dr. G. Samaram Garu, who has very well elucidated the importance of AMR and the steps to be taken to curb the AMR to reach a pandemic level. I also thank Dilip Bansali Garu. In spite of his busy schedule as national president, he graced this occasion and gave his inspiring speech and complimenting the IMAP state for the work we are doing in the field of AMR. I also thank Dr. Narendra Sayani, a good friend of all of us and a very inspiring leader with whom I have the pleasure of working in the RNTCP program, sir. We still look forward for you for the guidance in our future endeavors in AMR project. I thank Dean CGP National, Dr. V.S. Prasad, a very fine leader from IMAP State and a very good and generous leader from IMAP State. We wish his CGP count to be successful in the next month. I also thank my beloved president, Dr. Nandakishore, who is leading this AMR project in IMAP State with so many programs which already our speakers have told you. And I also thank Dr. M. Subhash Chandra Bose, the General Secretary, IMAP State, who has been a source of inspiration for all the programs going on in IMAP State, and Dr. Ravi Krishna, beloved past president, who has always been with us in all the endeavors for the last 5 years. He has been an inspiration to IMAP State. I also thank other, especially Dr. Kalyan, who has joined us, who is leading that surveillance project in spite of his indisposition. He joined us and explained what the AMR project is in IMA AP State. I thank my chairman, Dr. P.S. Sharma Garu, who never loses a chance to project the projects, whatever he is handling, and is a source of inspiration. We look forward to his future term as the president-elect and president in future. And I also thank all of the participants who have joined in good number to make this program a success. And as a convener of the program, I definitely go hand in hand with the lead team and my chairman to take forward this message of AMR across the medical profession and also the public. So public awareness program is the priority of AMR project in our state of Andhra Pradesh. I thank one and all once again for their sparing their time at a precious hours. So thank you all.
Thank you, sir. Thank you all. Good night.
Thank you, Fanidhar Garu. Thank you
you.
for your wonderful vote of thanks. You have covered everything and almost given a word of your total program. So once again, thank you all. Bye. Good night. Bye bye.
Good night, sir. Good night.
Good night.
Thank you all, sir.
All of us will
Good
meet in
night. Good night.
Good night.
రవికృష్ణ గారు ఇది రికార్డింగ్ అయింది కదా, అది కొంచెం కన్వర్ట్ చేసుకుంటుంది. ఒక 2 minutes అలాగే ఉండే వెంటనే క్లోజ్ చేయొద్దు.
లేదు సార్, క్లోజ్ చేయడం లేదు.
ఓకే అది ఆల్రెడీ రికార్డింగ్ స్టాప్ చేసేస్తే అది ఐ విల్ స్టాప్ ది రికార్డింగ్.
ఓకే సార్, క్లోజ్ చేయలేదు చెప్పింది సార్. మళ్ళీ